Hi, and welcome to Humanity RX, where we are sharing stories that highlight the human side of healthcare and bringing you life lessons from the bedside. We are your hosts, Jenny,
Tova,
and Jonathan.
And we're glad you're here.
I'm really happy about this guest today, Hannah Hoekstra. We'll get into how we go way, way back, but Hannah, thanks for joining us here today.
It's a pleasure to be here. Thanks for having me.
So I've known Hannah for it's like 25 years now. I don't know if you can believe that. But we were not in healthcare before. We were in like a communication and media, and we did a documentary. So we spent a lot of time together, and she's a very good friend, and she's so interesting. And so can you tell us a little bit about yourself and your connection to healthcare and why you wanted to get out of media and what made you switch to healthcare?
So I've been a nurse for 15 years. Nursing was, as you mentioned, a second career choice for me. Basically, when I graduated high school, I didn't think I had the maturity or, the study skills or any of the discipline needed to go into a nursing program. My father studied communication, and I was like, well, that sounds good. At the time I was living in Atlanta, where you and I met, John, and it's, there's a lot of media outlets there. So I thought it was a good option. And then my goals were very clear. I wanted to work at a national studio. I wanted to eventually get to production. I quickly met all those goals, and I kind of became tired of TV, to be honest. And then one night I got to be content producer. The national studio I worked for was the Weather Channel. I pulled this footage of a puppy running through snow, and it went basically viral throughout the Weather Channel, studios. And, this is the type of content we should be getting. And I got all these accolades. And the reverse was true too. If you made a mistake in TV, everyone knew about it right away. And, and I just thought, if I'm going to have this much pressure on me, I want it to be about something that is more important than this, because it's just the news, and it's just the weather, which is like just waiting for the news. Luckily, because I went to hospitals with a lot of resources, like when I worked at Duke, they had a counselor specifically set up to help you decompress from a bad, patient experience or a trauma. They'd actually would get the patient record redacted to protect their HIPAA information, so they could read the patient notes of the event of what happened. And before I even arrived, they were briefed on, the trauma I'd been part of. So I think whenever a child dies, it feels unnatural. So those have stuck with me, but I would use the resources and do those debriefing counseling sessions. I haven't had that much trouble debriefing or just, letting things go. One particular, when I worked at Grady, I did see a police officer that was shot in the line of duty, coded, and he passed. And that's probably something that's always stuck with me. I mean, really, if you want to keep sustaining in your chosen profession, you have to find a way. Like I always tell people, I was kind of dabbling in self-care before I became a nurse. And then when I became a nurse, within a year, I thought, well, if I don't really get committed to moving my body, eating right, regular counseling, finding resources to rejuvenate myself, I'm not going to be able to sustain this. And it's the older and experienced nurse that brings, a wealth of knowledge to the younger nurses. That was one of my goals. I wanted to be able to sustain so I could be the veteran nurse now at 15 years old, to share knowledge and to, have kind of that legacy of teaching. So that was my motivator for self-care.
Yeah. You're speaking Jenny's love language right now.
Oh, really?
Whole advocacy platform for mental health. But I think there's a lot of stigma around healthcare workers seeking help. So I'm glad to hear that those resources are offered and taken advantage of. Is there anything you would say to the audience, the people who may be afraid to reach out to do that?
My best advice, my simple advice, because I'm a retired ER nurse, I use like one words. There's jokes that ER nurses, they don't use as many words, but ask your supervisor, ask your charge nurse, say, I want a resource for this. I'd like to debrief. I think it's healthy. Can we all debrief together? Because ultimately everybody has a job. And if you ask your supervisor, it's their job to meet that need. And you're also advocating, just by being more human, you're advocating to usher in humanness into the medical profession, which adds to sustainability. And right now we have a real issue with retaining medical workers all across the board. And unless we start doing this in a healthy way, not only are we going to lose expertise, these institutions are going to lose money. It's $20,000 at a minimum to retrain a new nurse for a specialty. So, if we can get these CEOs and the people with the masters in public health to notice, hey, this is also expensive. Not only is it the right thing to do, it's the cheaper thing to do. But just ask if you need help. Just say, I think it's healthy to debrief what resources are available for that. And they might direct you to the counseling program. You can call them and they'll set up counseling sessions for you. I've done that 3 times in my career. You get up to 6 sessions and I've done all 6. And I think that the people that want to support, the people in mental health that want to support medical care workers, they're good at it. It's a self-selecting group. So I think there's a lot of resources under this layer of stigma. We don't, just work it out yourself. And there are unhealthy ways people are working it out. I mean, people are going to work it out themselves one way or the other. But for example, in emergency nursing, heavy drinking is rife. And I never got into that, but I have good friends that do, and I do see that's their way of coping. If you're going to work in healthcare and encourage people to, I don't mean to sound like in a soapbox or self-righteous. I really do believe these things. But if you're going to work in healthcare and encourage people to find a higher level of health or obtain, their optimal state of health, you have to be willing to do that yourself too.
Yeah, I agree. And I think other people hearing that people are seeking that kind of help helps them to feel less alone.
Right. Yeah. Isolation is like the number one, I think, mental health problem in the world across the board. And so if you're self-isolating, then by kind of keeping it, not even sharing it, not even verbalizing, it's okay. It's okay to say that was hard. That was hard. And I don't feel good after that. But I think you'll be surprised with what your managers come back with. And I would also do it in writing. I would do it in an email. That's my other piece of advice. Because you're gonna get a lot more. Yeah. What did you say, John?
Laughing because that's so Hannah. But it's great.
Getting an email. Yeah, do it in an email in a formal way because it starts an accountability loop. So
you have so much self-awareness and very clear goals for yourself. And then hearing the kind of cases that you gravitated towards, I'm curious how you ended up, because you became a forensic nurse at one point, right?
I did. Yeah, no, I'm still a forensic nurse. Yeah, that's how I work.
I'm curious how that happened.
I'm not sure if many people know what a forensic nurse is. I only knew because of you. So maybe you can kind of explain that first.
Okay. Well, I'm interested too, and I want to hear more. What are your understandings of what a forensic nurse is, Jenny or Tova?
I did not know what a forensic nurse was. Immediately, I'm thinking like forensic files and then going back and doing investigations. I was like, Ron, what's a forensic nurse? Because I don't know.
Okay.
Yeah, I also know because John told us.
Okay. So yeah, it seems a bit obscure.
I just think everybody should know what a forensic nurse is.
Okay. Well, so forensics is anytime medical and legal have a cross section. People would come in to the ER with non-life-threatening, non-physical traumatic injuries related to being assaulted. It can be a physical assault, it can be a sexual assault. And so they would come in and the doctors were tasked with doing the exams. So forensic exam is when the body of a survivor of some trauma or injury is basically it's evidence. And so you have to fastidiously collect what you're guessing or hoping DNA is, where it is on the body to help prove or, even disprove, or really you're just collecting. The goal is to collect DNA to send to the crime lab so they can sort it out. So I don't want to say too much about proving or disproving a crime as a forensic nurse because that's not my job, but you do a forensic interview asking a person what happened to you, very detailed. Where were you? Then what happened? I mean, this whole timeline, building it, you do it with an advocate in the room so that the patient has an emotional support. A forensic nurse is not an emotional support for the patient. You basically use the interview to build a map of where you're going to swab the patient on their body to hopefully find specifically DNA evidence or trace evidence, which can be fibers of any type. So what was happening 30, 40 years ago, as these patients were presenting, the physicians were pulled into the rooms to do these hour or two long interviews. And then sometimes, I mean, I've done a forensic case for up to 8 hours, 3 or 4 hours of swabbings. And then you wait for 2 hours for the police to come to do a proper handoff of evidence. Meanwhile, while the doctors were doing this, people were having heart attacks down the hallway. And it wasn't sustainable because it didn't meet the triage model. You can't be in a room for 4 hours with a patient that isn't going to die when there's 3 patients down the hall suffering, or, they're just going to get worse while you're in the room doing the interview. So doctors, as often happens in medicine, said, I don't want to do this. Let's have the nurse do it. And that's really how forensic nursing came about. And I went into forensic nursing also for a very specific reason. It's the largest scope of practice for an RN without becoming an NP or a PA. So forensic nurses, it's a 52-hour certification. It took me over a year. I had to do a ride along with the police for 12 hours. I had to meet with the district attorney and do, a lot of clinical hands-on. But forensic nurses are the only RNs that can do independent pelvic exams. And, if you know the state of the world, it's women that are at the most disadvantage for proper medical care. And a lot of GYN illnesses that really, in other countries that are limited with medical resources, a lot of GYN illnesses, uterine cancer is the number one killer of women in the world, actually, and that's because it goes undetected. And so I wanted to learn those GYN skills. So, you do a GYN exam, you see something, you give an antibiotic, that problem is solved. It also prevents that disease from being transmitted, as an STI to other future partners for that person. So that's why I did that. In a level 1 trauma center, you get a lot more sexual assaults that come in, but it's not all that a forensic nurse does. I would say, the lightest thing I've done as a forensic nurse is 2 guys get in a shootout, and, one gets shot in the lungs, and why the doctor is, putting a chest tube in, I'm, under the gurney, wrapping their hands in paper bags to preserve the gunpowder evidence. So when the police come and ballistics come, they can figure out who fired which gun and at what range, hopefully. So it's not all sexual assault victims, and it's not all dead bodies. It's people that committed crime or, are claimed to be a victim of a crime. And then that's when a forensic nurse comes in.
This kind of led you into a volunteer position at Burning Man. Is that right? Tell us a little bit about that story. It's really interesting.
So I totally fell into that. And honestly, it's kind of how my life is. I tend to gravitate towards need, and that's exciting for me to find the need and meet that need. I feel really useful. And so I was given a free ticket to Burning Man. I didn't know what Burning Man even was. This was 2015. A friend of mine just gave me a ticket. It said gift ticket, just like Willy Wonka, the golden ticket. I was like, well, thank you. I got in my car and I drove out there. And I was met by a 12-hour dust storm and being held at the gate, waiting for this dust storm to pass. I met the nicest people at Burning Man, people that have been going for 10, 20 years. I felt a real sense of community and connectedness that I'd been missing. They told me that, there was a problem out there, that some people were coming back year after year to perpetrate crimes against other human beings. And so what's going on, in my opinion, at Burning Man is that the organization is inadvertently attracting kind of the super sociopathic predator out there. And I've been in a prison and sat with people that are spending their lives in prison for assaulting other people. I've been in counseling, group counseling sessions with them, and you'd hear it across the board. They would say, we want to go to the communities that are remote and with the least resources, because that's where we can keep perpetrating without being caught. And so Burning Man's really in the middle of nowhere. It's the 3rd largest city in Nevada for the 10 days that it's there. It's a population of 80,000 people. And it's, scattered. Resources are kind of everywhere. Like I mentioned, there's, 80-mile-an-hour windstorms going on sometimes for 10, 12 hours at a time. So it's harder. It's more challenging to capture DNA, ensure the chain of evidence handoff. It was really apparent to me in those 3 days I was there that there was a real problem in that community. There's no cars at Burning Man. Money has no value. There's nothing you can buy. It's a trade. It's not even a trade economy. It's a gift economy. And so I got on my bike and I rode to the 3 medical camps. There's, Burning Man is an entire military grade hospital. You can get x-rays there. They can do anything. 2 years ago, a baby was born there at the hospital. So it's an actual real operating hospital.
Oh my gosh.
Yeah. But I went to each of the 3 medical camps and I found the woman that was in charge of the crisis intervention team. And I actually, through confrontation, I just said, you guys, this isn't enough of a response. You're having the same people come back. And at that time, if you had gone to Burning Man, if a person goes to Burning Man in 2015 and was assaulted, their reward for coming forward and trusting the system was to sit in a cop car with 2 usually male police officers. And although there are male victims of sexual assault, the vast majority are women. So a woman sitting alone in a car with 2 male police officers for a 2.5-hour ride to Reno, and then, getting a forensic exam. And I said, there's no way, I was skeptical. I said, there's just no way people are going to report. You have to have a better outcome with this. And the director of the crisis intervention team, which is a team of professionals that are all licensed, almost all of us are mandated reporters. They specifically select a team that kind of has something to lose if you're not, reporting the things that are going on. She just said, this isn't an appropriate conversation. We're not having this here, and I'd spent 2 days seeking her out and I was disappointed, but she said, but I would like to offer you a position on our volunteer team next year. I like your passion and your tenacity for what you're talking about. And it really surprised me. I just went there to kind of just advocate, but she was an advocate herself. And I learned a lot about doing the best you can do with what you have and also being patient with the process. So now if a person's assaulted at Burning Man will actually pay for them to take a private flight from Burning Man. There's an airport at Burning Man as well, to Reno, and they send an advocate with that person in the plane to go with them through the entire process. So we've really improved the process by being patient and being diligent, and that's how I fell into that. So
I feel like you've led 13 lives.
Oh, thank you. I'm starting to hear that more and more. I've just kind of followed my passion and the thing that, like I said, I gravitate towards need. And that's just been kind of an adventure of finding the new thing I'm going to do. And I don't know if John told you, but recently I became a mother. Also, trial by fire. I just adopted a little boy that I've been fostering since he was 3.5 weeks old. And now he's 18 months today, actually. Yeah, kind of the same story. Just, I actually was at Burning Man. This is a good segue. There's a whole city of people that build this, a whole group of people, migrant workers, if you will, that build the city. And then after Burning Man's over, they take that city down. So I'm the kind of migrant worker clinical nurse for them. So I'm taking care of those migrant workers as they're dismantling the city. And I got a call, and there's a little boy in San Francisco hospital. Can you come and pick him up? And I didn't have a car, because I had let my friend who'd come to Burning Man with me take the car back. So I had to hitchhike out of Burning Man to get back to San Francisco to go pick up my baby. And that will always be a true story. And I knew I could get back to San Francisco. There's a lot of different medical workers, and I knew I could, ride with somebody. But
why did I know you were going to say that?
But that's kind of where my life's at right now. I don't work in emergency anymore. I work in outpatient infusion or oncology. I really like that. I work at the county clinic in San Francisco. I found that I really like working at county clinics, again, gravitating towards need. There's people there that otherwise may not get care at all, especially in the modern American health system. And compared to an ER, I have a list of who's coming. I already know what's wrong with them, and I already know what medication they need. And compared to the ER, that's just like a dream come true.
Yeah. So
I've been doing that. And it's a more laid back job, and I've been enjoying doing that while also learning how to, be a mother. I'm an older mother, and there was only 2 days before I knew Eli, my son, was on the planet, and when he lived in my home. So I'm still learning stuff.
It sounds like that's part of what motivates you to keep going and not burn out, is your passion for learning too. You get comfortable in something and then you're like, okay, this is too easy. I want to learn something new. I can relate to that.
And your passion for helping others.
Yeah, I'm getting a lot from helping others too. I mean, I think that that's, it's not altruistic. I wouldn't even say that. I enjoy it. And there is a lot of learning, when you're helping others, because the more need there is, the more learning that goes on, and you can kind of be a co-learner with your patients. But this is definitely, parenting is the steepest learning curve, and it changes all the time. I have this document I give to babysitters or anybody that, will watch him. And I'm updating it every week with something new. It's your SOP for taking care of my child. He's forever growing and changing. And, I just love it. I just love motherhood.
Well, if people ask me to describe you on a personal level, I'll try to be like an ER nurse right now and give you like 1 or 2 words. It's Hannah cares deeply. There is nothing surface level about how you go about something. And one of the things that you mentioned recently to me was that being the best part of someone's worst day is what keeps you doing what you do. And so what would your prescription for humanity be, Hannah?
Just be useful in whatever way you can. And remember that working is not the only way to be useful. Earning money sometimes is the opposite of meeting the needs of what's really needed. So be useful in what you can, keep an open heart and open mind, and ask for what you need. I've never had to ask for more help than when I became a mother. I'm learning. Because I was so independent. And so, ask for what you need, because that shows vulnerability and also fosters connection. Be patient with the process. Be gentle with yourself, because that way you'll extend to be more gentle. Enjoy it and just celebrate the struggle. That's a nod to John and I worked on a documentary when we were in college. Mine was called Celebrating the Struggle, because that's really the only way to go about things. Enjoy the ride.
Thank you for listening to Humanity RX. We hope today's conversation gave you something to think about and maybe even feel a little more connected to the human experience. To find out more about our guest, please find more information in our show notes. Humanity RX is created, written, and produced by the 3 of us, Jenny, Tova, and Jonathan. If you enjoyed this episode, we'd love it if you subscribed, left a review, or shared it with someone who needs a little dose of humanity. You can find us on Instagram at HumanityRxPod or LinkedIn at HumanityRx. Until next time, be good to yourselves and each other.